So because of a very wonderful gift, in fact, from Michael Bloomberg, who was a Johns Hopkins graduate, we're able to form a malaria research institute with operations in the laboratories in Baltimore and in the field in sub-Saharan Africa. And our team are largely Zambian and Zimbabwean scientists who are very dedicated and skilled in their work. And the net result in southern Zambia is astonishingly positive. You can see that over the last 15 years, in the setting of the Macha Hospital, where our primary field site is, we've gone from about 100 deaths a year down to 1 or 2 deaths a year, down from 1,500 to 2,000 cases to down to about 20 or 30. And this is a combination of good public health work, as well as the application of modern molecular techniques to diagnose the disease, the carriers, and track the drug resistance of the parasites and the insecticide resistance of the mosquitoes. But malaria doesn't always happen just outside of the hospital. It happens in the rural outback, which is remote and hard to get to. And during the rainy season, just a few paths will connect these. But our field team is able, because of satellite imaging, to track the remote places in the outback and test for malaria presence in individuals who are silently infected. Adults who've had it repeatedly will carry the parasite in low levels, but not get sick. And of course, they turn out to be the origin of malaria in the young people when the rainy season occurs and mosquitoes pass the parasite around again. And these are amongst the poorest people in the world, working their hearts out to support their families. And when malaria strikes, it's usually it's disastrous. And everybody works. The children work. The older children care for the younger children. They carry the maize to market to be milled. But they also know how to have fun. Being poor is not necessarily a reason not to have happiness if the basic needs are provided. Love and some comfort. And there's tremendous love and treasure of the young people in sub-Saharan Africa. Children are the most precious gift any family can have. Yet these are the very people who are most vulnerable to malaria. The little girl on the left, your school book says school is cool. English is the language of instruction in Zambia. So in Congo, to the north and west, things are much more difficult, in large part because of the social disarray, because of the lack of stable government. Congo is enormous. This is the Congo River, which circumscribes the northern border of Congo. And here's my colleague Bill Moss lecturing with medical students in Kinshasa. But in the Katanga province in the east, which is a site of much recurrent instability over the years, this is where Dag Hammarskjöld was working. Things are underway, but without precise and good organization. The U.S. government, in the form of the President's Malaria Initiative, is providing medicines, but it looks by our workers' assessment that it's very difficult to get them distributed to the countryside effectively. And while they do have a good infrastructure in Congo, it's not well maintained. The trains are not running. And we really rely upon missionary pilots like this individual to get us to the rural outback to see where the disease is most prevalent. Because the rural outback is swampy, there are no paved roads, and it's difficult to get around. But there are very good people there. Here are pictures that's taken with some of the village health workers and the tribal chief in a village named Kilwa in eastern Katanga province. And here are the children. Turns out 80% of these children are infected with malaria every year. So we can do better. And in Zimbabwe, to the southeast of Zambia, things were under reasonable stable control for a long time. This is the British separating Zambia to the north, with Zimbabwe to the south. So they were sister states, Northern Rhodesia and Southern Rhodesia. But the presence of corrupt leadership, Robert Mugabe, who's held control of Zimbabwe for now more than 35 years, has had to make deals to stay in power. And this has led to a dissolution of the infrastructure and the demise of the public health system. And to operate in a place like Zimbabwe is not straightforward. In fact, shown here is Shungu Minati, our colleague, who is a capable scientist, University of Zimbabwe trained. She is, in fact, Robert Mugabe's niece. And by having her on our team, we've had no problems doing our work in Zimbabwe. Sometimes a little Machiavellianism is necessary to do your work. And Zimbabwe is a beautiful country. It was one time the richest country in sub-Saharan Africa with tremendous agricultural wealth. This is a tea estate in eastern Zim. And the people are wonderful. But they live modest lives. They live dependent on the river for their water source, for washing, for the religious ceremonies. But they have very simple lives, but they're very wonderful people. And the return of malaria to eastern Zimbabwe is a great concern. This photograph is a favorite. This is a grandfather, probably someone about my age. He was wearing his Sunday finest. And in Zimbabwe, they have names like love more, pray more, give more. I asked this gentleman his name. He said his name was Never. It's a remarkable name. How could you be named Never? He said, it's actually a nickname. My real name is Nevermore. And it turns out he's the 9th and youngest child. When he was born, his mother said, Nevermore. And the field stations, the health clinics in rural Zimbabwe are still present, and they're still ongoing, but they're in need of significant investment. The staff on each of these campuses is, however, exceedingly dedicated. The lady in pink in the center and I were conversing, and I asked her how long she'd been on duty, expecting her to say it's this last week. She said, no, I've been on duty constantly since 1992. Imagine having that level of dedication. And then every morning during the malaria season, the mothers bring their children in infected with malaria. It's almost 100% penetrance in this part of Zimbabwe. It should be tractable, but we need, I think, greater effort and scientific analysis of how to provide that most efficiently. And shown here on the left is our colleague, Sungano Marakura, an Oxford-educated Zimbabwean.